Welcome to this brief news briefing that we're going to have today following the vote to accept the mental health report, which we're all very excited about. Mayor Demings is here. He will be offering some comments on the report, followed by Jeff Hayward, who is the CEO of United Way, and Dr. Lauren Josephs, the author of the report. Donna Weiss is also here, who's been fighting this fight for 30 years for Orange County, along with our commissioners. And there is a parent and daughter, Amy and Anastasia, who were also part of the focus groups. They're off to the side, and you're welcome to talk to them. And now, Mayor Demings.
Thank you, Jane. Thank you to all of you for being here today. As you're well aware, the Board of County Commission just unanimously passed the acceptance of the report that has been prepared through the Heart of Florida United Way contract. And we worked with the Visionary Vanguard Group and Dr. Josephs on the production of the report itself. And so what it has indicated is that we have at least a $49.7 million gap in services here within Orange County for mental and behavioral health services. I say at least that because the report indicates that there's still some work to be done to identify the full cost of the integration of the technology across the various systems here within our community. There's a cost of transitional housing, et cetera, for those who are mentally ill or who are substance abusers. And then there's a cost of doing a campaign to make certain that we have the right awareness moving forward in this community. So from here, what happens at this point is that we will impanel a implementation team of individuals that will be representative of community stakeholders who work within this space, and they will help to lead us through a public-private and philanthropic partnership in our community on addressing the gaps that have been identified. And so with that, we'll open it up for any questions that you may have at this time. So in terms of how we will come up with the dollars to begin to address this, the implementation team will look at existing budgets and allocations through the different community stakeholder organizations and see if there's an opportunity for realignment of existing dollars. And then if there are new dollars that need to be brought to the table, then we will identify sources from federal dollars, state dollars, and even private sector organizations who may be willing to invest in this. The hospitals, for example. We know that when individuals do not get adequate treatment and they go to the hospitals, oftentimes they are uninsured or underinsured, and because they don't get adequate treatment, there's recidivism. They continually access these systems of care at tremendous cost. It can translate into increased costs even for our local Orange County jail. When we see perhaps on any given day, sometimes nearly 40% of our inmates are on some form of psychotropic medication. Many of them sometimes have co-occurring issues. They're mentally ill, they're substance abusers, they may be alcoholics. And what we have learned in this community, when we lead with treatment, we're able to reduce recidivism. Our jail population has correspondingly declined over the last 2 to 3 decades because this county made a public policy decision that we will invest more in treatment. We're one of the few counties in the nation that has a central receiving center where law enforcement officers take individuals who may be in mental health crisis, they take them to a central receiving center for treatment, and they're triaged, and the community kind of addresses the need, albeit is inadequate at this time, but it has resulted in a reduction in our average daily population for our jail from a high back in the mid 2000s to from 4,900 inmates to today about 2,200 inmates. That cost avoidance alone, by focusing through a public policy on treatment, has resulted in significant daily cost avoidance for us, several $100,000 a day, approaching nearly perhaps $100 million on an annual basis, because the leadership in this community saw fit to focus on treatment. So we know that it works, is what I'm saying to you, and so we're going to use the sum total of our past experiences and the data that has been collected even through this research project to guide us going forward in how we can strategically begin to address the gaps over time.
If I may, just if I could follow up on the second question, what do you tackle first? Is it the drop-in centers? Is that something that could significantly help the community right now, and so you go after that first, or is it something else?
I think that availability of bed space and treatment, is what we will begin to attack first. And we're doing that in many ways. Already we have the community, the crisis response teams that the Sheriff's Office and the Orlando Police Department are engaged in, where they have mental health clinicians who are responding out into the scene to kind of observe and then make referrals to treatment resources here within the community. There's the deficit, okay? Here in the United States, in July, a new call system has been determined and mandated under federal law, the 988 call system. So every state, every local government has to implement 988, and that is for individuals who are in crises to call that number and who may need mental health services. It's not to replace 911, where there's an urgent matter that can result in life-saving strategies. It is something that we have to make certain that we're prepared for. So the back of the house has to be in order. We have to have the resources, because the suggestion here is that if you dial 988, then that means that you got to have the community resources to respond to it. So this is a timely effort on our behalf. You're going to hear much more about this across the country, what 988 truly means. And so putting this task force in place to make this evaluation is truly important.
And Mayor, you said basically $50 million at this point, and then there was several things that were not included with that. How do you move forward with that?
Well, we know what they are, and the devil's in the details, and we're going to depend upon this cross-disciplinary team to identify what truly needs to be done. The integration of the technology, the IT across the civil and the criminal systems, if you will, as well as the various community service agencies that should be sharing information today. Because of the lack of a platform to be able to do that, we want to fill that gap. And that means that it's going to have some costs associated with it, but the implementation team, that will be the work that they will do. They will get into the details of where to begin, what to do first. And so that's the first step for us, is the implementation team of thought leaders that will come together.
One of the things that was raised was the issue of insurance coverage and how we've got a large number of people uninsured, and then even those with insurance, as was mentioned here, there's a limit on how many visits they can have, or even the co-pays are sometimes prohibitive for average wage earners. How do you address that?
Well, through some of our public-facing services, we will work again with the public-private philanthropic partnerships to provide those services, and hopefully those services and for those who need it the most will be free or significantly reduced. And so that's the start. And I think there's a commitment already existing in our community to be able to address that. You heard me mention Ken Robinson from the Dr. Phillips Foundation. He chose to participate in the process, and by his participation, he's saying that the Dr. Phillips Foundation has bought into being part of the solution here. And there are others who are doing the same within our community. So I am confident that with the collaboration with the hospitals, with the various foundations, with other divisions of government, that we can come up with a better system than what we have today. Okay.
You explained that the pandemic played a really big part in mental health within the last 2 years. What can you say about that?
There's no question that whenever in our lives we're human beings first. When you're chronically stressed, when you don't have enough income to take care of your family, when you're out of work, when you're sick, all of those are stresses for us that sometimes if you don't deal with can translate into mental health needs. And so that's happened. We're not unique. That's happened all over America. I believe that from the federal government, they have recognized that. And so we have been the recipients of significant federal dollars, our taxpayer dollars coming back in this community to address some of these things. So we're going to, when we make determinations of how to expend those dollars that we have received, we have made some priorities. We have made priorities in our community to assist families, to assist small businesses. We have provided dollars for food insufficiency to Second Harvest and others. We have provided dollars for mental health treatment and counseling through partnerships that we have with the school district, with other social service providers. So much is already underway in this community. And so we just want to harness that and make certain that it is a coordinated effort going forward.
Last question.
Have you identified any possible locations for drop-in or treatment centers throughout the community that could relieve the burden at the jails, the emergency departments?
That will come. I mean, we are fortunate in our county. We have the primary care access network that we have in place. We work with our community health centers, and we have even helped to provide some funding for services through many of them. And then we have our crisis stabilization unit at the Central Receiving Center, out off of Mercy Drive, where services are being offered there. And we're working with different social service agencies here in our community. We're going to continue to do that. Orange County has been truly a leader, I think, in this process over time. We've had a number of task forces over the last several decades that have come together. It's been a while since we have convened this breadth of a review within our community. And so the report is a starting point to really inform the entire community that we are owning this issue at this point, and we collectively, those who are standing with us today, this Board of County Commission, we are committed to doing something about it. Okay, thank you all very much. All right. We still have a Board of County Commission meeting we have to attend.